Well, everybody, thank you for joining us and welcome to the July General Membership Meeting of the Heartland Continuum of Care. As we meet this morning in the chat, if you could put your name, your organizational affiliation, or if you're a community advocate, just please add that there. And then due to a mistake I made, if you could also indicate whether you were with us at the June meeting, that would help us a great deal. So with that being the case, the first item on the agenda is the minutes for the June meeting. And as you reviewed those, if you remember, it was a presentation heavy meeting. So we provided links in the minutes to those presentations or to those resources. And then one key thing about the June minutes is that it doesn't have a list of attendees. And like I said, that's because I failed to record that. So with that being the case, we would ask that you would consider approving the minutes with the addition of the attendees that we learned from this meeting. So if you're favorable or if anybody has any edits, please let us know at this time.
This is Dave, and I make that motion.
Thanks, Dave.
This is Amy, and I thought they looked great. I second it.
Excellent. All in favor, could you indicate with an aye or a thumbs up?
Aye.
Aye.
Hi.
Thank you. Any opposed? All right. Well, our next item on the agenda is, you know what? I started on slide 13. You win some, you lose some, folks. Here we go. Let's we'll sneak peek. Okay. The next item on the agenda is that we have Susan Day with us, and Susan is the new Illinois coordinator for the Central and Southern region for the Supportive Housing Providers Association. So we're grateful to have Susan working in our region and grateful to have her this morning to talk about her role and to talk about SHPA. So Susan, we'll turn it over to you, but thanks again for being with us.
Well, thanks for having me. For those of you who may not know, just a brief little overview of SHPA and what we do. We are a statewide membership here in Illinois. We're an organization whose mission is to increase supportive housing and those services that accompany the supportive housing to meet the need throughout the state. And of course, to increase that whenever possible, like I said. So basically, our organization has three pillars. We accomplish our task through three separate pillars, which is advocacy, quality improvement, and resident leadership and empowerment. So, you know, we try to increase that capacity of providers through those three pillars for the best possible outcome for the supportive housing residents. We're also an information hub and a community organizer. We provide networking opportunities for those agencies who may not, you know, make connections otherwise throughout the state. We know there's a lot of agencies that are really good about networking within their county or COC or region, but it's really nice to know what's happening throughout other parts of the state. So with the advocacy piece, I think SHPA is well known for that. And we just came out of a very high advocacy season with the state advocacy and the federal Capitol Hill Day that we participated in with the National Alliance to End Homelessness. So good news, I think all of you have seen this, but the government has signed the Housing is Recovery pilot program just this week. So that's really exciting. This supportive housing pilot program will work with people who are homeless or at risk of institutionalization. Say that 3 times fast at 9:10 in the morning. Or the existing people that are institutionalized that have mental health or substance abuse, so that they're not, you know, thrown into homelessness upon release, or that they have to be institutionalized not to experience homelessness. The exciting thing about this that the governor signed as well is that additionally $10 million was appropriated for the program through the American Rescue Plan in the fiscal year 22 state budget. So we're really proud because SHPA helped create this program and advocated very strongly for this program. So that's a huge win, and we'd like to say thank you because we know many of you we're involved with this advocacy effort. And also too, I would love to say that there are openings for our advocacy committee. So if this is something that you've always felt very passionate about, that committee meets, I believe it's the fourth Tuesday of the month at 1 o'clock. Don't quote me. You can reach out to me. I'll give you the information for that, because this is a brand new committee, which is, a subset of the legislative committee to really drive those advocacy efforts. And it'd be a really good thing to get involved in if that's of interest to you. The training and technical assistance, again, to support agencies to be the best programs that they can be. Today we're having show your work training, which is for DHS grantees, to actually learn the reporting process and to help case managers learn why we collect the data and things like that for that reporting. So actually that training is at 10 o'clock. I'll probably have to jump off this meeting a little bit early for that. I apologize, but we also are involved right now with a really exciting series, the Dimensions of Quality training. So again, it's free for members, free for DHS grantees, and just super exciting, some of the trainings that we have, especially in light of this virtual world, where many folks were not able to participate in trainings because everyone went virtual. We were able to really convert quickly and continue with our training. The third pillar, of course, is mine. So my focus is not only on the central and southern region and to develop relationships with all of you in that area, but to really revamp the resident leadership and empowerment program to help those agencies that have supportive housing interests in tenant councils and forming a tenant council, what that looks like. And really that is a true form of empowerment, because we all know that, if you're bought in where you live, you take better care of the property, you're more interested in what's happening. And it really is a form of empowerment to affect where you're living. So I want to revamp the storytelling for those that have the lived experience, to be able to tell their stories in a safe way that doesn't re-traumatize them, what that looks like. And just coming out of, Capitol Hill Day and being able to speak to representatives, to have those with lived experience, I believe has the biggest impact for those state and federal legislators, to realize, that this is not just some speak that we're talking about. We're not just trying to get money, from the budgets, but that this does affect people, and this does affect homelessness. So ultimately, SHPA's goal is to end homelessness in Illinois. And I truly believe that we're all doing a fantastic job, and we can actually be the model for this to maybe go federal. Wouldn't that be exciting if Illinois could say, hey, this is how we do it, and this is how we did it, and let us help you solve homelessness in your state as well. So other than that, I wanted to just say I'll be visiting your area. I'd be excited to meet any and all of you. If you'd like me to come, see your project and your area of expertise, I would love to do that. I'll drop my contact information in the chat box. And unless any of you have any questions, I'll turn the meeting back over to Josh, and I won't take up any more of your time this morning. But thank you so much for having me.
Thanks for joining us, Susan. We'll create a little space if you have questions for Susan, but I really would encourage you to go to SHPA's website, get on their email list. The trainings that they've put out are really fantastic. There's a lot of great content there, and there's a lot of great opportunities for connecting with other people who are engaged in this work here locally in Central Illinois and across the state too. So it's a fantastic learning community, but also a great way for us to connect with others and grow in that way too. So Susan, we'll be excited for you to come to town and to meet with you, and we're grateful for your work.
Thank you. I also did forget the Monday memo. So there's a Monday memo that's sent out every Monday, and it's really got a lot of good information. You can also sign up for that on our website as well.
When we send the update following this meeting, we can create some links to the site and some of that as well for everyone. So that'll be great. And we can include your email address in there if that's all right for folks to connect with you.
Absolutely. Thank you.
Excellent. Well, great, Susan. Thanks again for being with us.
Thank you.
Okay. Well, the next item on our agenda is we really wanted to take some time to unpack our short-term strategy that we've been advocating for several months now. A lot of this is born out of an ongoing community conversation as we think about Springfield, and as we've seen just the need around homelessness in our community. We want to share very clearly about what the continuum of care, the Heartland Continuum of Care, is advocating for. And some of that that I hope to do in the next few minutes too is to clear up some misconceptions about what the continuum of care even is and what it can accomplish and can do in our community. When we hear conversations at city council or in other public forums, a lot of times there's some great components there, but sometimes too the impression is that the continuum of care is something a little bit different than what it actually is. And so the first thing that I'd love to just talk about is we, as we gather on this call, are all part of the general membership. And so you are a part of the continuum of care, and you're a part of this work that we're doing to end homelessness in our community. And so as we engage in this work, part of our mandate comes from housing and urban development. And really our goal as a group, as a body, is to take our collective impact, to take our expertise, and to strategize and plan a coordinated and comprehensive approach to providing housing and services for people in danger of becoming homeless or experiencing homelessness in our community. And we do that work by promoting an integrated community-wide strategy and then planning to prevent and end homelessness. And then we provide coordination among the numerous local organizations and initiatives that serve the homeless population. So we're a community that you'll hear it said sometimes that we're resource rich. We have a lot of fantastic partners who are engaged in that work. And so helping us all to communicate together and be on the same page is part of what the continuum of care is and does. The continuum of care, however, does not control organizations. When you hear some of the comments made, you might get the impression that we as the continuum of care have the ability to tell organizations, independent organizations, what they should do and when they should do it. And that is not the case. In terms of funding, sometimes you might get the impression that the continuum of care is sitting on a large pile of money that we are not getting in the hands of our agencies, and that also is not the case. The federal government, HUD, has a continuum of care program. The competition for that will be beginning here in the next couple months, but our community gets about $400,000 roughly through that program. A lot of that is used for permanent supportive housing and other programs as part of that. And a lot of that is wrapped up in renewals. We have organizations that are doing great work around that. And so that funding goes towards that. Part of our community improving and getting better at what we're doing and how we're coordinating services and strategy is that we want to do increasingly better through that competition and bring more funding to meet the needs in our community. But the other source of funding that commonly comes through the continuum of care and that we talk about in this body is the Emergency Solutions Grant. And so that funding is around $130,000 on an annual basis, and can be used for things like rapid rehousing, emergency shelter, street outreach. And so those are the two pieces of funding that the continuum of care works with. And the continuum of care is not a 501c3, so we're not a pass-through. We don't hold that money. So really our role is to plan, to organize, to coordinate, but it's not to control our agencies. We really, our imperative is to work together to end homelessness and to try to pull together all the community partners we can in that work. So represented on the call today, we have partners from the medical community. We have partners from local philanthropy, from organizations who are doing great work. And so that's the work that we're doing and the work that we'll continue to do. And one of the key ways that we organize that work is the crisis response system. So as we adopted this model back in 2018, It's a best practice that communities across the country are using to be effective at actually addressing homelessness in a holistic way and ending homelessness in communities. And there are 5 key components of the crisis response system that we've adopted as a community. The first one is outreach. A lot of our organizations have outreach initiatives, right? So, for example, connecting with people who are unsheltered and helping them to become aware of the services that are available to them. That's an important part of the crisis response system. Another key component is coordinated entry. HUD mandates that our community have a way to prioritize and assess people who are experiencing homelessness and to connect them with the appropriate services. And so coordinated entry is the way that we do that. Prevention and diversion, to the degree that we can help a person to avoid homelessness to begin with, that's something we want to take very seriously, and that's a key component of the crisis response system. Emergency shelters, when people become homeless, we want a place for them to experience the stability of a bed and care and case management around that, so that they can work and access different resources available to them to end their homelessness. And then permanent housing, right? The crisis response system, if we're really going to do this work of ending homelessness, we need housing outputs. We need the ability to take a person who is experiencing homelessness and help them through the coordinated entry process, connect with an appropriate housing intervention, whether it's rapid rehousing or permanent supportive housing. And so this is the system that we use. This is the way that we organize our work. And it's in line with what communities across the country are doing as they're really addressing homelessness in a holistic way. But as a local community, as we look at the system and as we look at where we are, we constantly want to improve, and we want to get better at this, right? And the way that we do that as a community is really expanding the resources that are available. With the current pool of resources that are available in our community, we are like communities all across the country who have an inadequate amount of resources to address a complex social need. And so there's a lot of unfortunate things that flow from that. One key piece of that is that it leads us to a system to address homelessness that is effectively stuck. This slide is from the National Alliance to End Homelessness, and I think it captures pretty well where we are as a community. We have a number of people who are unsheltered. We have a number of people who are sheltered. And we have a number of people who are supporting and housing, but we can only do that to the degree that we have appropriate housing supports, which means, a place for people to go, a rental subsidy to pay for that, but also supportive services. The work that the Continuum of Care does to help a person in stable housing is not housing only, it's housing plus care, right? Case management and other supports that help a person stabilize in a meaningful way in housing. And as a community, we have an inadequate supply of permanent supportive housing and rapid rehousing to meet the level of need we have for people who are sheltered in emergency shelter or who are unsheltered. And so one of the key ways that this has manifested itself in our community over the last several years is that we create seasonal overflow shelter. And I think it's important to sort of see this, right? So when we do that, and I guess to go back, in this scenario, we have 49 people who are unsheltered, 30 people who are sheltered. This is purely for example. These are not our local numbers. So what we do around November of each year is that we create this overflow shelter. And so we go to a lesser number of people who are unsheltered, an increased number of people who are sheltered, but it's the same number of people who are experiencing homelessness in our community, right? When we create more emergency shelter or we create more overflow shelter, it's an important intervention, but it doesn't end homelessness. And it's important for us to keep that on our minds as we advocate for a way forward. But there are ways to move forward also that actually end homelessness. In this scenario, we have 34 people who are unsheltered. We have 30 people who are sheltered. But then we've moved 15 people into rapid rehousing. And so we've helped them into stable housing. And so again, in order to end homelessness, housing is key. And as a community, we will not end homelessness unless we invest in housing, unless we help our agencies increase their capacity to hire case managers to create those supportive services, and also come alongside that with the rental support that's needed. That's the key to moving forward. So one of the things that you hear often in conversations in the public is that, well, as a community, we don't have a plan. And when you hear that, what I want you to know is that we do have a plan, and any entity that says we as a community don't have a plan, what that means is that entity themselves doesn't have a plan. And we would encourage them to get more deeply connected with the continuum and support the plan that we're advocating for to end homelessness. As a continuum of care, we put together a strategy work group last year, looking in the midst of a pandemic, looking towards the ongoing pandemic and the needs that would exist. And we worked together to put together a short-term strategy. And the short-term strategy is how we believe we can move forward right now in an effective way to actually address homelessness and work towards ending homelessness, functionally ending homelessness in our community. And some of the key components of the plan that we're advocating for and have been working to execute are rapid rehousing and permanent supportive housing. As funds do become available to us, we are prioritizing some of these interventions with those funds. And so when $600,000 became roughly a little bit more than that through the CARES Act for the Emergency Solutions Grant, we were able to allocate over $150,000 to expand rapid rehousing initiatives. And that was through two organizations, Helping Hands. I'm sorry, another person's entering the call here. Helping Hands has had a rapid rehousing program and has had a great deal of success with that, even throughout the pandemic, and continues to build on that work. And Mercy Communities is in the process of creating a rapid rehousing effort, and we're really excited about that. Alongside that, through the American Rescue Plan, a brand new program was created to foster a partnership between public housing authorities and continuums of care. And our community was allocated 35 emergency housing vouchers. And so these vouchers, it's been a wonderful opportunity for us to partner with the Springfield Housing Authority. These vouchers don't work off the same waiting list that the Springfield Housing Authority has. It works through our coordinated entry process, which is again, it's a new program. We're still in the midst of developing exactly how that's going to roll out. And then these vouchers also come with some administrative support dollars. And so as a community, we've been thinking about how to best use those. And one of the key things that we're working to create through that is a housing navigator position. This is a position that's never existed in our community, to my knowledge. And Helping Hands is actually going to be the entity that's going to hire that person, and that person will serve the continuum of care for these emergency housing vouchers. And in the general membership email, you received a link to that job description. So I encourage you to check that out and look at that. Actually, responses are due tomorrow, and we'll talk about that a little bit. It's another agenda item here in a moment. So, but that's a key development. As we think about how do we look at moving forward, often people ask us, well, what are we talking about here? What kind of money would make a really tangible difference for people who are experiencing homelessness in our community? And, as we've looked at those numbers, as we've looked at what it would take to increase case management capacity, supportive service capacity, but also to create, rental support. We've developed basically a rough number that's $750,000, an investment in the community to create a flexible pool of $750,000 that could be used for case management and rental support. It could help over 100 people in our community. Now, when we say that, it would take some time to hire people and to ramp those programs up. But if that level of money was made available to the continuum of care to spend on rapid rehousing and permanent supportive housing, we could help build that capacity among our agencies to serve over 100 people. Our current coordinated entry list has over 100 people on it right now who are waiting for rapid rehousing and permanent supportive housing expansion. And so it's not a mystery what we need as a community. It's really clear what we need. We need more support to expand permanent housing. And that's got to be a key point of strategy for any funding that becomes available in our community, because that's what ends homelessness, right? Along with that, homelessness prevention is key, right? To the degree that we can help people from experiencing the trauma of homelessness, we want to do that. And Fifth Street Renaissance has been a fantastic partner in our community to in that work. And recently, the Illinois Department of Human Services has created and expanded an emergency rental assistance program. Fifth Street was among 7 homelessness prevention providers in the state that applied for those funds. and received those. And they'll be receiving over $500,000 for this emergency rental assistance program for this fiscal year. More information will be coming out about that. But also during the second round of Emergency Solutions Grant CARES Act funds, we as a continuum invested $150,000 in homelessness prevention to really hopefully help avoid the fallout of the eviction moratorium. And so that's a key point of intervention as well. Emergency shelter. This is another, and probably this is the point that at this point in time is getting more conversation in the community. And as we look at emergency shelter in our community, we really want to look at the data, right? How many beds are available? You know, for our existing emergency shelter providers, right? So Helping Hands, Contact Ministries, Youth Service Bureau, Sojourn Shelter. These are organizations that are fully staffed. These are organizations that have expertise in providing this shelter. They have case management, they have services, partnerships with medical community, all built into the work that they do. And as a community, it benefits us to help people access the services that these shelters provide. For the last 2 winters, we've created a winter emergency shelter that did not work through an overflow model. And so in a sense, that shelter competed with the other shelters in our community. And the result of that really is not an efficient use of funds for our community. And so we began advocating last year that when the winter emergency shelter closed, we really wanted to see an overflow shelter take its place. Now, the reason we advocate for overflow shelter is exactly what I said. We want to connect people with the shelter beds that are already available in our community, paid for through various entities, and deeply connected to those supportive services. We know that there are gaps in our system, right? We do not have enough emergency shelter capacity for the number of people who are unsheltered and experiencing homelessness. So there is space that we need overflow for those who don't fit within our existing capacity. There are also people who, for various reasons, may not be eligible for shelter beds in our community. And so the overflow shelter will help to address some of that need as well. And then a key part of the overflow shelter is that it's designed to be a low cost intervention, right? So we want this to help meet this need, but to do it in an economically efficient way so that we can continue to invest in rapid rehousing and permanent supportive housing. So as funds become available, our priority 1 is supportive housing, ending homelessness. But while we do that, we still need this Band-Aid type of effort is sort of how it's referred to really help make sure we have a safe place for people to get off the streets and to begin to stabilize and connect with those case management services. So we continue to advocate for that. We would like to see that as a year-round effort. And as we look at the numbers, we anticipate that an overflow shelter would likely serve probably in the winter up to 30 people. And so it doesn't need to be a massive effort. It really needs to be the right size in order to use funds wisely and make funds available for those housing interventions. And so we'll continue to advocate for that. We know that the city and Salvation Army are in conversations about that. 2 weeks ago at the city council meeting, Mayor Langfelder talked about the development of non-congregate emergency shelter. At this point, we don't really have a clear idea of what that means as it comes from that direction or what exactly is being worked towards there. And we continue to seek conversation there to learn more. But we really hope that the city and any other funding entities would join us in this effort and in the strategy that we've developed here. Another key piece, another thing that has been said at City Council is that agencies aren't doing enough as it pertains to outreach. We have a number of different outreach efforts in our community. Some of them are volunteer run. Some of them are from supportive services for veteran families. Some of them are through local agencies who have employees who are working in a number of different directions, but also go out and do outreach. And then we also have Chris Jones, our homeless outreach team lead. And then we have organizations like Helping the Homeless in Springfield. So there's a variety of outreach work going on. And we've been pulling that team together to really focus on how to do that outreach in a way that really connects people with services and works with them in the direction of housing. And so as we do that, we're excited that Memorial Behavioral Health and the city of Springfield have partnered using some of the city's CDBG CV funds to create a position at Memorial Behavioral Health for that outreach work. It's great for us as a community to have more people who are devoted to fully devoted to that outreach effort. And so for that to continue to grow is a great effort to connect people with these services and with these agencies that exist. Another thing that we're working on is the development of an app that would help our case managers, help those doing that outreach work to collaborate in a pretty seamless way as we work with people, particularly who are unsheltered. And then another thing is we put this strategy together, just recognizing coming out of the pandemic, the need for day services. And Washington Street Mission at the beginning of May began a phased reopening and has continued to expand their services as they're able to. And as a community, we want to encourage that expansion and help to support them as they continue to serve people in a variety of ways. So there's a lot there. And I know you may have questions. If you have questions, what I would say for the sake of time is that I would love to connect with you one-on-one. And so please feel free to reach out to me through email. You got the general membership email. You could simply respond to that and say, hey, Josh, I'd like to talk about some element of the short-term strategy. I'd be happy to do that. But we have a plan. We have a plan that frankly, if our crisis response system is adequately funded in the way that it needs to be, our community can make significant strides to reach functional zero to end homelessness. We have fantastic agency partners in place. We have fantastic partnerships with the medical community. All of these can be built on with more resources invested strategically and smartly. And as a continuum, we have to continue making that known and continue pushing in that direction. A couple of key things that I'd also like to mention is that we have an unprecedented opportunity here. And again, it's absolutely imperative that we use these resources that are in our community and coming in our community in a strategic and smart way, that we make decisions that are driven by our local data and really, again, place that focus on ending homelessness through these supportive housing interventions. The city of Springfield this year will receive over $2.3 million, almost $2.4 million through an entirely new program. So the city of Springfield each year gets homes or gets funds as part of what's called the HOME program. And through the American Rescue Plan, HUD has created this new program called HOME ARP, so HOME American Rescue Plan. And what it does is it takes a traditional HOME program. It really, and the goal as it's stated on HUD's website, is to assist individuals or households who are homeless, at risk of homelessness, and other vulnerable populations by providing housing, rental assistance, supportive services, and non-congregate shelter to reduce homelessness and increase housing stability across the country. And it can be used for these 4 eligible activities: production or preservation of affordable housing, tenant-based rental assistance, supportive services, homeless prevention services, and housing counseling, and then the purchase and development of non-congregate shelter. So at this point, this is basically what we have around what this program will consist of. HUD has not released guidance about how exactly these funds can be used. I'm really hopeful that maybe they take a similar approach as they did with the emergency housing vouchers, where in order to get those funds and use those funds, the continuum of care had to enter into an MOU with the Springfield Housing Authority. I would love if HUD would do something similar with this. In order for our city to use these funds, if the city and continuum of care had to enter into an MOU together, I think that would be a really effective thing. But part of that is these are funds that will come to our community that the continuum of care, as it appears, has no control over. We will be bringing a recommendation to this body, and we'll be making a recommendation to the city about how we think these funds can be best invested, looking at local data and looking at that goal of actually ending homelessness. And we look forward to the partnership that can flow from that. But we want you to be aware of this because, again, this is an unprecedented amount of money coming to our community to address homelessness. And for us to use these funds in a smart and strategic way could really be transformative for our community. Another key thing about these funds is they can be used through 2030, right? So when they come in, we don't need to spend them in 3 months on one project, but we can really look at our long-term needs and make a plan for using these funding that can create some sustainability, around addressing the need in our community. and I'm wrapping up here, I promise, for those of you that are sleeping. While we work on all of this, at the same time, we are in the process of developing a long overdue community-wide strategic plan to address homelessness. And we're doing that with the support of the City of Springfield, the Community Foundation for the Land of Lincoln, Memorial Medical Center, Sangamon County, SIU, Springfield Housing Authority, St. John's Hospital, and the United Way of Central Illinois. So while we work on these short-term initiatives, we also will be putting, over the course of the next 6 months, and you certainly will be a part of that process, we'll be putting together this long-term strategic plan to really give our community a clear action steps for moving forward. So we as a community, we have a plan, right? What we would really love for you to do is to join us in advocating for this plan. And then the other key part, frankly, I'm frustrated with the fact that our agencies who are under-resourced continue to be dragged in public forums. I thought Erica Smith, everybody, if you could check to make sure you're on mute, that would be fantastic. Thank you.
Someone that's having surgery.
Sounds like she might be on the phone and don't realize it.
Right. I can't get to the, I lost my, all right, we'll let it roll. As a community, Erica Smith did an interview with Sam Madonia last week that I thought was really fantastic. It's worth a listen. You should go to, it's posted out there on WMAY's website. There's a link on the Continuum's Facebook page. But I thought one of the powerful things that she said was just around our need for our community to unify. We need to hold our community leaders to a standard of helping us to unify, not continuing to to take shots at agencies. Let's build together towards this future that is very realistic of functionally solving homelessness in our community, and let's stop the rhetoric and the political games. We have a plan, support this plan, and let's move forward together. And if we don't, we continue to create a community where people suffer and are unsheltered needlessly. So please join us in advocating for the agencies you work with, the agencies you support. Tell the stories of the great work you're doing, but also hold our community leaders to a standard of working with us and working in a unified way to truly end homelessness. So that's my spiel for the day. And again, please, if you have questions, comments, please connect with me. I'll be happy to talk more with any of you. All right, next piece of this, Housing Navigator. Again, I won't belabor this. This is an exciting opportunity for our community. This Housing Navigator position, you can read more about what it will do, again, in that job description that's in the general membership email. But a key part of this, right? Working with landlords, developing those relationships that help us to utilize the emergency housing vouchers that are coming to our community in a efficient way, and help to connect people with these housing resources really quickly. So we want to move fast with it. That's why it's posted out there. Information is due to Erica Smith tomorrow, and then we're hopeful that this is could be a bit of a pilot project, that this position becomes a permanent position for our community that really helps again create that movement in our system towards housing interventions that end homelessness. So want you to be aware of that. Again, if you have people who you think might be a great candidate, quickly get in touch with them and get the job description to them. All right, you're tired of hearing me talk. I understand that. And so the good news is that we have 3 folks joining us. We have Dr. Sandarishan, Gayla, I'm going to butcher your last name here, so please correct me, but Gayla Havener, and Dr. Tracy Smith to talk to us about the Delta variant. Obviously, you've seen talk about this in the news. It's has been an emerging issue. And as we think about shelter and other work that we're doing, I thought it'd be great to have some of these local experts share with us things that we should be thinking about as it pertains to the Delta variant. So I'll get out of the way. Thank you so much for joining us, and thanks for being here to share with us.
Thanks, Josh. This is Tracy, and I'm going to kick it off, and then I'm going to really turn it over to Vidya and Gayla because they are the experts in this. I had reached out to Josh because I know I'm seeing a lot of concerns and questions and information coming out about the Delta variant. And being on the Continuum board, I had asked Josh, had we really had an update back to you guys as membership members about the Delta variants and given an opportunity to kind of ask some of your questions about how does that affect maybe some of the guidelines you're using or where we currently stand and some things to think about. So I had reached out to Josh to see if he'd be interested in just a brief conversation about this for everyone and then kind of opening up for questions that you might have for Vidya or Gayla. So I am going to turn this over to Vidya to kind of lead us down a little conversation to share a little bit more about the Delta variant, some of the thoughts and the processes that we're having here in the Sangamon County area, and also maybe a little bit about what we're seeing across Illinois. I know across our borders in Missouri, we are starting to see some uptake and some concerns on some of our counties that border that. So Vidya, I'll turn it over to you now.
Thank you so much, Tracy, and thank you, Josh, for having us. I want to just talk generally about the Delta variant and some of the issues that have come up in conversation. And then we'll take some questions. Gayla is the expert from public health who deals with a lot of questions on quarantine, isolation, and what we can do to mitigate the transmission. So I will start off with really what is a variant of concern. Delta variant is considered one of the variants of concern. So WHO and CDC are able to categorize the changes, the small mutations and variations in the viral structures as they become more transmissible, have the potential to cause severe disease, or the third thing is they evade the immune response from vaccination. So these three features can typically make a variant concerning. So we have a few of those which WHO as well as CDC have identified. Alpha variant, which came from UK, was considered about 50% more transmissible. So we would go with a character called R0, which really talks about the transmissibility of the virus. COVID, the regular strain was about 2.5, the R0. And the British variant was higher, about 50% higher. And now with the Delta variant, we're expecting that to be even higher as compared to the British variant, about 60% transmissible. So the R0 for the Delta variant is anywhere between 6 to 8. So you can imagine how many new infections are potentially caused when there is exposure to a Delta variant and somebody is not vaccinated. So that about the variants as such and variants of concern. These are being tracked very, very carefully at CDC. These are being tracked at the state level. And how do they do that is by surveillance testing. They sample about 10 samples from different parts of the community and look to see if any of them are carrying the Delta variation or the changes in their structure, the genomic structure, mainly in the spike protein. And they're also looking to see what the different variants are here in the community: alpha, beta, gamma, delta. So we still have a predominance of alpha in Illinois. We have, as of yesterday, they'd reported 10,413 variants that they had identified. And alpha was 6,877 of those. Delta in Illinois was still at 288. Also to remember that we're not testing as much as we used to, so we may be just seeing the tip of the iceberg there with the Delta. The question comes up as to routine testing. Can routine testing identify Delta variants or not? If you're doing antigen testing, antigen tests do have the capacity to identify the Delta variant, but they could miss. They could miss because antigen testing in itself is less sensitive. About 10% of COVID in general can be missed with the antigen testing if it's not done at the right time. So there is a potential to miss the Delta variant if you're using an antigen test. But also with PCR, because of the changes in the structure, and PCR really picks up those proteins, which it's specified already in its manufacturing and the way it's structured the test. So there's a chance that that could be missed on PCR as well. So how do we identify this? You have to additionally ask for a genomic sequencing. And if there's any concern or question about this being a Delta variant, then you specifically have to ask for those tests in patients. So the point I want to make is that tests are not perfect in picking up Delta variants, and there's a chance that they could be missed. Is there any other way that we can identify if we're not routinely testing, if we're not administrating as many tests? What are some of the other ways that we can identify? The symptomatology. Here with Delta variants, most people present with a runny nose, headaches, as compared to high fever and fatigue, which used to be the presentation of COVID typically. But now this is more like a common cold symptom, and that kind of muddies the water a little bit more, because we are also seeing other respiratory viruses, and with fall, they're not going away. You can have influenza, para-influenza, RSV. All these are also on the rise. So symptoms kind of give a tip off, but you still need to look carefully and ask for the exposure history, etc. The last thing I want to address is protection for Delta variants with the various vaccines. The mRNA vaccines do protect. There is a little bit of a decrease as compared to the common strains of COVID. So 96% was what we would expect with Pfizer. And Moderna really didn't have that number for COVID, but for the Delta strain. But from Pfizer, some of the data from the UK says it's 88% effective against the Delta strains. And for Moderna, they did come out and say it is effective against the Delta strains, but we don't have a exact percentage. It's definitely not 96%, it's lower. So what do? We have to try and get as many people vaccinated as possible. The herd immunity, if we can go up to 88%, from what we really wanted to target for the routine strains of COVID at 65 to 70%, now the herd immunity kind of goes up with the infectivity. So if a virus is more infectious, if you have a higher herd immunity, you're able to kind of protect more people. So that's really the answer again. Everything comes back to vaccinating and getting more people vaccinated. So that's all I wanted to talk about with regards to the Delta variant. And Gayla, if you have anything to add with the isolation and quarantine and what we are seeing in Sangamon County, and then we can take questions.
Well, with the different variants, there's a lot of questions out there right now about quarantining and the times, because it seems like there's a different quarantine time for every group of people or different groups of people. But with any of the variants, IDPH CDC does recommend 14-day quarantine regardless, and 14-day isolation actually. So normally it's 10-day isolation, but for one of the variants, especially the Delta, they recommend 14-day isolation of that person. So that is a little bit different than what we've been doing. The problem is that a lot of times we don't know that it's a variant until that time period has passed. So, but I think we're getting better at looking for it and getting them turned around faster. So you may see that people will be quarantined or isolated. Isolation is if you're sick and have to stay home. Quarantine is if you're exposed and have to stay home. So most times people are isolated for 10 days, but with the variants we'll isolate for 14 if we're aware of it before that 14-day period is passed.
So thank you very much, Vidya and Gayla, for that update. I kind of want to open it up to see if anybody has questions. I also wondering if how we feel we are prepared for quarantine and those kind of steps, as we may see some increasing numbers again, since we kind of had some decrease, and now just wanting to make sure that we're staying proactive and aware. So just want to open it up to make sure that if there's any questions that any agency has in regards to this.
I'll make a quick comment there. When you have new residents, you may want to get the history of exposure, and then where they're coming from. So epidemiology and history are really important. If you have the capacity to do antigen testing upfront, which I know most shelters are doing and most agencies are. So if you have the capacity to do that, that is a quick and easy way of identifying something that may be there. But again, it's important to the history and the epidemiology are very helpful in helping us at least have a heightened level of surveillance there for new people that.
Vidya and Gayla, just I wanted to verify, a lot of our neighboring states are kind of hotbeds right now for some of this variants. So do you want to kind of talk about some of those neighboring states, so when the history of someone coming from those states may be very eye-opening, we need to be aware of?
Do you want to talk about that, Dr. Sundaration?
Gayla, go ahead.
Okay. Well, you're right. There are some hotbeds, southern Missouri, and these are basically areas with low vaccination rates. Southern Missouri, specifically Springfield, Missouri, the hospital is overflowing. One of my coworkers has a personal friend who's a nurse in Cape Girardeau, which is because this affects Southern Illinois. It's all together down there. And what they are seeing is that the major hospitals in Southern Missouri they're overflowing. They don't have enough beds. I know ventilators are short too. And so what they're doing is, if someone's better, they're only taking the sickest, and then they're transferring the less sick out to the rural hospitals to care for them, because there's just not enough beds. I do know that IEMA has called back the ventilators that they had doled out to us earlier in this area to help us out with the surges that we had earlier, and they're sending them down to Southern Illinois. Also, some of my tracers, or our tracers, not mine, have told us that just yesterday that don't go west in Illinois, because over by Blessing and Quincy and that area, again, low vaccination rates over there. They're seeing a large number of positive cases. And one of the things that they're seeing is children. And that was concerning. The person I talked to was how many children they're seeing, because they're a vulnerable population. They can't be vaccinated. So if the adults around them aren't vaccinated, the other thing that we're seeing big outbreaks is church camps. Well, camps of any kind, but specifically right now, church camps. And these camps are having, one I heard about yesterday, 1,000 people at a time with no masking, no type of COVID mitigation strategies used. So we're trying to, I was on the phone yesterday trying to get some of the samples from that church camp specifically sent in for variant testing, because we suspect Delta in these. So there is hotbeds, and they're all around us, and so they will be affecting us, and especially the homeless population, because they're pretty transient. I think that it might impact them quite a bit as time goes on. So we're not over this yet at all. It's people, I think when the masks came off, everybody thought, oh, good, we're back to normal. We are not back to normal by any means. And so I think we need to be aware of that and not let down our guard as far as testing and watching for symptoms and, that type of thing. I don't know, can you add anything, Dr. Sundaration?
No, you pretty much covered the important things, Kayla, there. Yeah, I just want to reiterate that for Delta, it's across the board, not just old people, but young people too, anywhere from, teens to 50 years. That's where we're seeing a lot of people getting sick. And then, like you were saying, travel. There are states, one state is really lax, one state is not, but because of that, we do see infection being transmitted from one person to another, and that's how it's hard to mitigate. And then the vaccination rates in Missouri were about 31%, really low. So that's probably one reason why the Delta variant kind of spread really rapidly there as well. Tracers do a great job of trying to identify sources. So if you do identify anybody that's positive, do reach out to the health department. Gayla is always there. Gayla, I'm talking for you. The connections there with the contact tracers, etc., can be established early. So that was another thing that I would just like to add.
I would like to add something. We are seeing a lot of breakthrough in people who are vaccinated. However, they're not getting real sick. They're, it's kind of like the flu vaccine where, you can still get one of the other strains of the flu because the flu vaccine is only against 3 strains usually. But you don't get as sick. And so even though we are seeing breakthrough cases, with vaccinated people, we're not seeing the hospitalizations and deaths. So they tend to have a milder disease and less chance of passing it on. But there still is some chance of communicating it to others if you become sick and you are vaccinated. So vaccination, you may hear of that, and it is true that there are breakthrough cases, but like I said, they're much less sick. And it's a real benefit to get the vaccine because it may keep you from dying. I mean, quite literally. So I did want to bring that up because that people always mention that yeah, well, I hear so-and-so had the vaccine and they got it anyway. Well, that they may have. One thing we do see is people who are exposed continuously are more likely to have a breakthrough. Like say one of their kids gets it, well, you're very close with your kids and you're in constant contact with them, especially if they're little and they have runny noses and, so you're in contact with them every day, all day. Those are the type of situations that we're seeing right now, is that people who are exposed frequently for long periods of time are getting it. Not that others couldn't, but it is still very much of a benefit to get the vaccine and just use common sense as far as, protecting yourself.
Josh, I know we're at our time, but I did want to just add one more thing to what Gayla said. Getting the vaccine is important, and completing the dosing of the vaccination is critical. One vaccination itself is not as good as the 2 vaccination if it's a 2-step process. So again, at the shelters, if you're identifying folks who have 1 vaccination, please contact any of us to help get them in to get that 2nd vaccination done, because that is very critical in the process of stopping the variant. So Josh, I'll turn it back over to you. Thank you for the time. We just really wanted to kind of reiterate this because we know that in Springfield right now, we're feeling good. We've got a good vaccination rate going on. Everybody has done such a tremendous job, but right around us and our neighboring counties and our neighboring states, that is not the same story. And so we know, of course, that it will pass over to us and we will have to deal with it. So thank you.
Yeah. Well, thank you 3 for being here today, but not just that. You've been wonderful partners for our agencies for the last year and a half, especially in the midst of this. And so this has been a really, I think a timely and informative presentation for all of us to not let our guard down, especially around having policies and around quarantine and things in place, to continue to make opportunities for vaccination available. And so again, agencies, if you need help with this, we have fantastic partners here who are willing to help you through this and, can help with providing testing and other things. So please do get connected. And again, thank you very much for being with us today.
If anybody has questions, please call us. We're available. And there's an after hours number. If it's an emergency, they can get a hold of somebody. Somebody's on call, but we are more than happy to help you with any questions or problems that you have.
Excellent. Thank you. For the rest of our agenda here, we're just going to hit on a couple things. Katina, are you available to talk about the Youth Advisory Board? I'm going to take that as Are you there, Katina? We'll bypass that for now. In regards to our task group updates and agency updates, we're not going to go through each one of these today. But if you're on the call today and you have something urgent pertaining to your agency or the task group that you're working with, if you wouldn't mind coming off mute and sharing that update right now, that would be great.
Okay, this is Archie Ford with Supportive Services for Veterans. We are working with the IDPH, and we're going to have a clinic for testing, giving the vaccine out on the 9th of August with a follow-up on the 30th of August. They're saying they're going to use the Johnson & Johnson is an option, but they're going to be doing the Pfizer unless that changes. And I can register people for that now, but that's going to be on the 9th of August in the parking lot of the Salvation Army.
Excellent. Thank you, Archie.
So with that, Archie, if you could make sure that's listed in 211, that would be absolutely fantastic. We are seeing a spike in calls regarding COVID-19 and vaccines to 211 right now. So if any of you also know of any free vaccination clinics that will be happening, just make sure your information is in 211.
Okay.
Excellent.
That's it for me.
Thanks, Archie. Any other updates? We probably hit on a lot of them during the strategy conversation, but if anybody has anything else they'd like to share.
Hey, Josh.
Yes, ma'am.
Tracy here. I just wanted to reiterate any of the executives on here that have not sent me your MOU. I need it by the 30th of this month for HMIS. I just re-upping that, even though I just recently sent out an email.
Thank you, Tracy.
Mm-hmm.
All right. Well, everybody, thank you again for your time today, and thank you for your partnership and working to make the experience of homelessness in Sangamon County rare, brief, and non-recurring. So we're grateful to have all of you engaged in this work. With that, I guess we would entertain a motion to adjourn.
I motion.
Thanks,
Tracy.
Second.
Thanks, Dave. All right, all in favor, indicate with an eye or just log off, I guess would be another way to do that. Thanks again for joining us.
Except for all the coordinated entry people.
True. If you're actively engaged in coordinated entry, please remain on the call for a by names walkthrough. Thanks, everybody.